Welcome back from lunch, everyone. I would like to introduce Camila Arizaga, social worker and regional program manager for Miami-Dade and Monroe counties with the ALS Association Florida Chapter, presenting ALS 101.
Hi, good afternoon, everyone. Like Marisa said, I am the regional program manager for Miami-Dade County, and I'm very happy to be here and be part of this 8th annual Hope and Help Symposium. So welcome to ALS 101. I'm going to go ahead and get started. I hope you can all see my slides. So this presentation says what to do, where to begin, and it's basically a starting point for newly diagnosed patients and their families. It's all about taking charge, being practical, and preparing to adapt. Okay. Click next. I hope you can all see this nice bubble over here. So there's really no easy way to hear you have ALS, but approximately 15 Americans hear those words every day. If you sign up for this presentation today, chances are that you or a loved one has been recently diagnosed. And some, if not all of the thoughts that I've added in this slide have crossed your mind at some point. So we have things like resources, research, safety, legal advice, medical care, what government benefits I have, right? So I'm going to touch on these topics. And the information provided in this presentation today is going to be summarized. The objective is really to give you a starting point and an overall guideline to navigate the disease and be a step ahead. And we'll have some time for questions and answers towards the end, okay? I want to start off by talking about multidisciplinary clinics and the care they offer. I'm sure most of you have already heard about multidisciplinary clinics, and they bring together this team of medical professionals that are specially trained to meet the needs of those living with ALS, allowing the patient to receive care from each discipline during a single visit. Studies actually show that multidisciplinary care confers a survival advantage for patients with ALS and is superior to developed community-based care. So it involves a multiple decision-making process within a multidisciplinary setting that leads to an enriched set of clinical encounters for the patient that enhances clinical outcome. Okay, and I do want to point out that the ALS Association is actually the certifying bodies for these multidisciplinary clinics around the nation. The clinic team usually involves a neurologist, a physical therapist, occupational therapist, respiratory therapist, dietitian, psychologist, speech and language pathologist, a social worker, and an ALS Association chapter liaison. So I'm going to go very quickly to the next slide where I have a map of the clinics that we have in the state of Florida. I'm very happy because in the last few years, we went from having 5 clinics to having 9 clinics. And there is a mix of centers of excellence and just ALS centers. And the difference is basically that those that are called centers of excellence offer research. They're conducting research on site, but they have the same high quality approach to multidisciplinary care. If you're not familiar, this is the first time you're hearing about multidisciplinary clinics, please let us know. Your regional program manager in your area will be able to help you and tell you which one's closer to you, and basically guide you and see where your needs are and if you're interested in research or not, where you should go. Okay, so I'm going to leave that map here. The good thing is that we have a lot of options and there's more care available in Florida than ever before. I want to talk a little bit about the National Registry as well. I'm sure that by now you've already heard about the National Registry if you haven't done so before. It's a congressionally mandated registry for persons in the US with ALS, and it's the only population-based registry in the US that collects information to help scientists learn more about who gets ALS and what causes it. It basically looks for common ground and see if there's any red flags that then can help guide research. The information collected from these surveys could possibly help people with ALS in the future by allowing healthcare providers, researchers, and other interest groups better understand who gets ALS And they are also used to promote research on improving disease management and developing standards for care for ALS, right? So I've left the website there in case you haven't gone there before. If you wish to participate, please allot around 40 minutes for the survey. And again, it's incredibly useful information, that's data that's being collected nationwide to guide research and physicians and have a better understanding of the disease. So if you haven't done so, please take a look at the National Registry when you have a chance. And speaking of research and guiding research, I want to talk a little bit more about some benefits that you could have if you choose to enroll in research. You may have access to promising new medications and interventions before they become widely available. You may receive research-related care or medicine at no cost. You may be able to take a more active role in your personal healthcare decisions. Your health may improve if the study therapy proves to be effective, of course. And even if you don't directly benefit from the results of the clinical trial you're taking part in, the information gathered can help others add to scientific knowledge. Clinical trials are vital to the process of improving medical care. I'm personally a big fan of research. I think we need to raise more awareness about what's out there, especially in Florida. We have 5 centers of excellence that are conducting research on site. And in the next slide, I'm just gonna give you an example of clinical trials so that you have an understanding, right? I'm not gonna go over them. This is just like a listing of things that may be available close to you. But I want to highlight that there are a lot of research being conducted about ALS worldwide, nationwide, and in the state of Florida. We have the Northeast ALS Consortium, known as NEOS, that help translate these scientific advances into clinical research and new treatment for people with ALS. We also have clinicaltrials.gov, so you can also access that information online, which is a database of privately and publicly funded clinical studies conducted around the world. We have ALS Untangled, which is the website that actually Dr. Betlag created and curated, and we're going to hear more about it, I'm sure, in his presentation that's coming next. And also Patients Like Me, that it's a platform that helps patients compare treatments, track symptoms. So there's a lot out there online, different platforms, different initiatives around the country to have more research, which is key to finding possible treatments and cure. Now, I want to point out real quick the needs of controls. A researcher must only measure one variable at a time, and using a scientific control group gives reliable baseline data to compare the results. And why am I bringing this up right now? It's because if you have a family member, a friend, a colleague that does not have the disease and wishes to participate in research and add to science, they can also participate and be part of the study as a control. If you have more information, you can always ask the closest multidisciplinary clinic conducting research, and I'm sure they'll be happy to hear that you have people, if not yourself, family members that are interested in participating and helping science move forward. There's also a lot of resources, information, and support out there. The ALS Association has compiled so much information and educational material for our patients and families around the nation, really. There's a variety of webinars in our website, resource guides. We have 11 modules of resource that address many of the common concerns and issues that people with ALS face, such as speaking difficulties, nutrition, mobility, or even respiratory issues. We have resource and support groups throughout the state of Florida. There are 17 right now. They've all gone virtual because of the pandemic. And, I encourage you to reach out and participate, or at least try it once, to go to these support groups. They're very educational. They're by county, by region, but we also have for veterans, for caregivers, and for newly diagnosed patients, which is the one that I'm facilitating. Also, like I said, the chapter regional program manager facilitates a group in each region, and they usually invite speakers to talk about relevant topics. And it's also combined with time for attendees to discuss and share information and provide support to one another. But yes, there's a ton of information out there, forums, blogs, groups, and social media. You do have a network of support, and we want to make sure that you know that. Obviously, the past 16, 17 months have been a little bit funky with COVID, but ALS doesn't stop, and neither do we. So we continue to provide support and continue to move forward with our support groups. Until further notice, they will be all virtually, but we're here, and you can always reach out to your local regional program manager for more information. Wanted to make sure that you know that the support is out there and that we're here, and that there's other people in similar situations, and you can really help build that network of support and share with people that are going through similar situations that you are. And a lot of this presentation, it's about how to be proactive and not reactive, really preparing for the possibilities. And again, keyword, possibilities, being ahead of the curve. And I don't mean to live in the future and worry excessively about things that may not ever happen. What I'm trying to say is that you have to have your toolbox ready and handy, right? It's like having that hurricane bag next to your door. We may not get hit by a hurricane this season, but just in case, we want to know what the plan is, right? Ultimately, that will give you peace of mind. If you're proactive, you're focusing on preparing. And if you're reactive, you're focusing on repairing. So I encourage you all to be proactive. And I think you already took a great first step by joining us in this presentation today. I think my slides are a little bit delayed, but hopefully we're all on the same page right now. I want to touch I want to talk a little bit about disability benefits and retirement. This is very complex, it's very in-depth, and it's very case by case, but I didn't want to completely skip this information, right? And this is the very basics. For Social Security disability, obviously, if you're under the age of 65 and have paid into the Social Security system, you can apply for Social Security disability the day you stop working or when your work hours decrease. It's very important information to know. In terms of Medicare, when Social Security disability goes into effect, patients are automatically enrolled in Medicare. There is not a 2-year waiting period for Medicare for patients with ALS, and that's something that changed a few years ago thanks to our advocacy efforts. So I do want to highlight that information. Advocacy is extremely important. Employers' disability and retirement benefits. Make sure you're gathering information from your employer or consult a financial advisor for this, but it's something that you want to keep in mind. In terms of taxes, you can always contact your local property tax appraiser officer about property tax exemptions for people with disabilities. And don't forget to request prescriptions from your physicians for sales tax exemptions on items that you need due to your disability that are not covered by insurance, right? So again, with taxes, this is again very case by case, but there's a $500 exemption for total and permanent disability. If you're paraplegic, hemiplegic, or you must use a wheelchair for mobility, you may be eligible for total exemption based on income limitations, right? So just make sure that you keep this in mind, that that's a benefit that you could possibly take advantage of and you don't want to miss on. And there we go. Again, health insurance, another topic that is very personal and case by case, but just make sure that you're reviewing your health insurance coverage to understand what care and equipment is covered and what is not. A basic suggestion is to keep Medicare as your primary and any other, be it Humana, Blue Cross Blue Shield, as a supplemental insurance. If you have private insurance or are enrolled in Medicare HMO, request an insurance case manager. They can help you understand better. Insurance can get very complicated. And it's also important to know when open enrollment is if you wish to change your Medicare and or supplemental policy. I also want to talk about SHINE. SHINE is a free program offered by the Florida Department of Elder Affairs and your local area agency on aging. So it has specially hired trained volunteers, actually, that can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. These services are free, unbiased, and they're confidential. It varies a little bit county by county in what they offer and how much availability they have in terms of consultation and services. But it doesn't hurt to know that this is out there, right? And we want to make sure that you're using all the possible resources in your community, in your county, in your area. It's extremely important, right? So things to keep in mind, always health insurance is very important. Now my next slide is still showing up. There we go. Another topic is important documents. In the thought bubble that I put at the beginning, I added as one of the thoughts that people get at the beginning of the diagnosis is like legal documents, legal advice. What should I do? How should I manage this type of things, right? And this doesn't apply only to ALS patients. This is something that we all should be aware of, that we should all take into consideration, and that we often keep or just look in a different direction. You would like to consult with an elder law attorney to make certain your property will, living will, healthcare surrogate, and asset placements for care decisions are addressed. Do not leave that for the last minute. And again, this goes for everyone. Designate your power of attorney, very important. And the social worker at your local multidisciplinary clinic can help you with these forms as well. So that's good to know that you have also help. Discuss and decide if you want to have a DNR, that's a do not resuscitate form filled out. Something that you want to talk to your family member about, your loved ones. They can be hard conversations, but these are really conversations that we need to normalize because they apply to all of us. Again, the social worker in your multidisciplinary clinic will be able to hand you these forms, help you fill them out. They can keep a copy and you can keep a copy, but you need to understand that you don't want to leave these things for last minute and put your family members in a difficult situation if there's ever a need, right? You can consider ALS specific advance directives. And in case you don't know, advance directive is a form that you fill out to describe the kinds of medical care you want to have if something happens to you and you cannot, and you cannot speak for yourself. It tells your family and your doctor what to do if you're badly hurt or have a serious illness that keeps you from saying what you want to say, right? So you don't want to leave that weight in your family, in your loved ones, your family members. It's something that you want to do while you can do it, and make sure you have those decisions already made and in writing, right? And then also the 5 wishes. Completing 5 wishes is another way to write your advance directive, essentially. These documents are important because it keeps your family, friends, and your doctors, again, out of this difficult position of having to guess what kind of treatment you want or you do not want. Okay. I also wanted to share with you this quote. It says, your attitude, not your aptitude, determines your altitude. Okay. So this is very important. You want to make sure that you're keeping yourself active, that you're finding fulfillment, that you're including your friends and your family members in your life and not isolating yourself. They're there to support you, and trust me, they're willing to help and do more than you're expecting them to do. And most of the time, trust me, it's from the best place of love and care, right? So now that you're going to stop working, maybe you're going to reduce your hours, you're going to be working less, you're going to have more time in your hands, and you have to take this as something positive. What do I want to do with this extra time that I'm going to have, right? Do what's important to you, not to others, whether it's writing a book, volunteering, going to a baseball game, taking a cooking class, and just really spending time with the people that you love. And I'm gonna share some actual items that patients I work with had in their bucket list. And granted, this list was prior to COVID, so act accordingly, pick your activities accordingly. But I really encourage you to come up with your own. And one of my favorite ones here, it's really try all the cheesecakes at the Cheesecake Factory. I thought that was kind of brilliant. But I'm sure we all have things that we want to do, that we've been wanting to do. And now that you have that extra time, it's the perfect moment to start checking those things, right? Maybe it's learning a new language, planting a tree, fostering dogs, solve a Rubik's Cube. I've never been able to even get close to that one. That's still on my bucket list, right? And also this one, it was amazing. Actually do the things on my bucket list, at least in my family. Every New Year's, we come up with ideas and things that we want to do, right? And we cross like maybe 1 out of 10 in the year of our bucket list. So, you know, I just wanted to inspire you to get creative and to know that there's a lot of fun things that you can do and that you can involve your loved ones and family members. Moving forward, this is in case you are a veteran. I want to touch on veteran benefits. Veterans are actually twice as likely as the general population to get ALS. If you are a veteran with ALS, apply for VA services, or connected with compensation benefits, or register with your VA medical care. Veterans may actually attend an ALS clinic and receive care both inside and outside the VA healthcare system. And you can always register with a VA service organization, such as Paralyzed Veterans of America, to advocate for you. And I've added the website as well as a phone number there if you want to take notes. I know this is being recorded, and also this presentation is going to be uploaded to our website. But yes, if you're a veteran, first of all, thank you for your service and everything that you've done for our country, but also know that there are additional benefits for you. And if you have questions, doubt, you can contact your regional program manager, and we'll help you get connected to receive those benefits. This is going to be very quick, and I might be a little early in your time. I know everyone that's listening to this conversation is newly diagnosed, but that varies significantly from patient to patient. But I did want to point out about the equipment that you could possibly need. And it's good to know the sources if and when the time comes. So there's different types of equipment. We have mobility, communication, assistive technology, safety, and respiratory equipment, right? And I've listed some of the items there, but you have to know your sources. A lot of that's going to come from insurance. We also have the ALS chapter loan closet, which we have 2 partner companies that helps us facilitate that, which is Ability Medical Supply and Emotion. You can contact your regional program manager if you need equipment from our loan closet. We work together hand in hand with the ALS clinics to make sure that the equipment that we're sending you is safe for you, that you've been assessed for it, and it's what you actually need. There's also a lot of ALS equipment exchange in social media and different platforms online, where you can exchange equipment, swap, and even sell. And then obviously we have Craigslist, eBay, Amazon, and different retail stores. And we also offer quarterly grants at the ALS Association Florida Chapter that can cover a certain amount of monies that goes towards equipment that may not be covered by insurance, or that we may not have available at our loan closet. Okay. And then last but not least, I want to touch on 2 things that are never too early to start. And the first one's actually stretching. Stretching and range of motion exercises should be started as soon as possible after diagnosis, as part of a gentle, wellness-oriented daily routine. It's never too early to start. You can always consult with your physical therapist. It's going to help you maintain range of motion. And I just wanted to make sure that you knew that this information is very valuable, and stretching is really going to help you, especially at the beginning, with fasciculations, with any type of cramps or like muscular pain that you can have. So discuss it with your physical therapist. It's never too early. And the second and last thing that I wanted to share with you is voice banking or message banking. Again, never too early to start. Even if you don't have bulbar ALS, even if your voice hasn't been affected, you can start recording your personal, meaningful voice messages to use for a communication device later on. You may not need this communication device, but it's always good to know that there are some apps and there are some platforms on the internet that you can use, like muddletalker.org or seraproc.com, where you can start recording either your messages or your voice banking. Voice banking is a little more complex. You create synthesized voice-based recording speech samples for future use in a speech generative device. So I encourage you to start doing these two things: stretching, voice banking, message banking. It's a great starting point. It's part of preparing. It's part of being ahead and being proactive and not reactive. And with that, I'm going to end my presentation. Thank you for allowing me to share this information with you. I hope it was really easy to swallow and useful information. If you have any questions, know that I'm here and you can always email me. Again, I'm the regional program manager in Miami-Dade County, so you can always email me with any questions that you may have. And I also facilitate the ALS newly diagnosed group. We meet the last Tuesday of every month. If you want more information on that, I'll be happy to share it, and you're welcome to come and join us at any point. Thank you and have a wonderful weekend.